COVID-19 still poses a significant threat to our health and our communities, and we are really aware that many of us are still vulnerable to it. One of the ways in which we could reduce the threat and impact of COVID-19 is a vaccine. A vaccine would provide some protection by training people's immune systems to fight the virus, and that would stop them becoming unwell. At the moment, no vaccines have been developed that can protect the body against COVID-19, but researchers are working really hard to change this. Some clinical trials are underway to test the safety and effectiveness of vaccines, and this is a necessary stage when you're developing any new medicine, treatment, or vaccine. The topic of vaccines divides communities. For many, and in particular Black, Asian and minority ethnic communities, the word vaccine generates a lot of fear. And this fear is generally rooted in mistrust, which is completely understandable. There are a number of historic examples in which Black and other marginalised communities have been exploited and have been the victims of unethical medical research, including tests for vaccines. Due to this, there is an anxiety amongst many Black, Asian and minority ethnic communities that they are not valued and will be used as guinea pigs in some way. This mistrust and anxiety then leads to a reluctance in taking part in a trial. And this is a problem because this means that we can't test the vaccines in these communities and we can't know that a vaccine truly works for everyone. I am happy to say that things have changed significantly in recent decades. There are now a number of policies and procedures in place to stop unethical medical research. However, I also completely recognise that there are still concerns. COVID-19 has affected all communities, but unfortunately it is clear that Black, Asian and minority ethnic communities have been disproportionately affected. This makes it even more important that any outcomes from COVID-19 research, including new treatments and ways to prevent the disease, work for and apply to all communities. And it's only by doing this that we can truly take control of COVID-19. As a Black doctor and researcher, I feel it is crucial that whilst we may have reservations as a community about taking part in vaccine clinical trials, this needs to change. To help this, we must have regular access to and be updated with factual and accurate information, new learnings and knowledge. Within East London, we are working really hard to make sure that this happens by ensuring all communities are given the correct information about vaccines and clinical trials. We're doing this so that every individual, family member and community member can make an informed decision about whether to take part in a vaccine trial or not, and when the time comes, whether to receive a vaccine or not. Entering a clinical trial or receiving a vaccine is entirely your choice, but please let it be supported by accurate information.